Good afternoon, everybody. The chairman of the Presidential Task Force on COVID-19 Response, Secretary to the Government, honorable ministers, the permanent secretaries, the national coordinator, the DG, directors, and ladies and gentlemen here present. May I also join in welcoming our colleague, Dr. Walter Kazadi Mulongbo, who is our new WHO country representative to Nigeria and assumed duty about 2 weeks ago, and familiarizing himself still with this terrain. The total number of confirmed COVID-19 cases in Nigeria crossed the 40,000 mark to 40,534 over the weekend, with 555 new cases recorded in the past 24 hours, and on the whole, 17,374 persons have been successfully treated and discharged from hospital. We have regrettably lost a total of 858 persons, most of them with comorbidities. With 262,579 persons tested so far, we have crossed the 250,000 mark, and as you know, we are heading for the 2 million mark. When the epidemic curve will begin to flatten is still a matter of conjecture, given the relatively small fraction of our population that has so far been tested. It is our plan and our endeavor that our health system be not challenged beyond what it can bear. 60 PCR public health laboratories are now active in Nigeria, and together should be in a position to address the testing capacity challenges and ramp up utilization if the logistics are able to get proper improvement. This would, along with the sheer community spread, be responsible for the rising trajectory of the epidemic curve in the population so far tested. The 70-30 male to female gender ratio and the case fatality in our country of 21% have not changed significantly. But 2/3 of all fatalities remain in the over 50-year-old group, while comorbidities like diabetes, hypertension, asthma are common among all fatalities. They underscore the need, as we have always said, and I repeat again today, that we need to protect senior citizens and the vulnerable from infection by giving special attention to risk communication targeted at them. Again, I say we give priority for admission, for observation and treatment, so that complications can be easily detected and attended to before they blow into out of proportion. Of utmost concern are still our young asymptomatic cases with the potential to spread this disease while themselves being quite well, and of whom the young and able-bodied can be difficult to manage. We see that in other countries too, where there can be resistance to efforts to control this disease, working with the population. But it is clear that success in managing COVID-19 will depend on a very strong relationship between the governing and the governed, and the strong collaboration of citizens with laid down rules and recommendations. We continue to strive to improve the quality of service in our hospitals as more persons are admitted to treatment. But this time, not only for COVID-19 infection, but for routine and essential care. It is our desire to reduce fatality rates, as I've said, expand treatment capacities such that our health system cannot get overwhelmed. In this regard, the Federal Ministry of Health expects to take delivery of a newly completed isolation center at University of Abuja Teaching Hospital, Gwagwalada, very soon, just as other centers are under construction nationwide. So we're expanding our bed spaces and our capacity to admit in expectation, as we have always said, being able to prepare for the worst and strive for the best. The UN system in Nigeria has informed us of the arrival of another consignment of essential COVID-19 related commodities yesterday, to be officially handed over to us soon. We remain appreciative of the UN system for this gesture and their consistent support, which greatly increases our reserves and recognizes our needs, especially of oxygen concentrators and personal protective equipment, but also reassures our frontline health workers that we are well stocked and can ensure availability of essential items and consumables at point of use. I also use the opportunity to salute our frontline health workers whose service helps to reduce fatality and urge them to continue their work in line with global best practices in case management and to keep themselves safe and take no risks in the course of rendering service. Coronavirus does not respect doctors or nurses. As this holiday period approaches, I want to wish again our Muslim brethren happy celebration and enjoin all persons not to forget the prescribed precautions and to reduce the risks of transmission, even as we celebrate. Very simple. Wear your mask at all times, especially when out of your home. Wash your hands regularly. Use sanitizers. Practice distancing. I remind everyone that controlling the spread of COVID-19 is not the responsibility of government alone, but of all of us individually and collectively. No one should think that they are immune to this dangerous infection, and everyone should bear in mind that they are their neighbor's keeper, and their neighbor will also protect them. Thank you for your attention.